For the first time in several months, Governor Eric Holcomb and the state's top health leaders were together in person, publicly addressing COVID-19's impact in Indiana.
A year ago this month, the state was rolling out the first COVID-19 vaccines to frontline healthcare workers and select others. The message then remains the same now. The vaccine is the way out of the pandemic. WRTV's Nikki Dementri is live outside of the Indiana State House after covering the governor's address. And Nikki, we're seeing thousands of new cases today.
Nicole, we're seeing nearly 8,000 new cases reported by the Indiana Department of Health tonight. And now Delta remains that dominant strain in the state, but health officials say we're going to see a steep increase in cases and Omicron is soon to catch up. I want to take us over to the Indianapolis Motor Speedway. That's where they've been doing testing and a vaccine, a state-run site there. Now, the health commissioner, Dr. Kristina Box, notes since the end of November, the site has run 10,000 plus tests, and a third of those happened just this week alone. She said there was a 28% positivity rate among rapid tests. Chief Medical Officer Dr. Lindsay Weaver says there are breakthrough cases, but they represent a small percentage of the overall positivity rate in the state. Now, once again, our top health leaders and governor pleaded with Hoosiers to get vaccinated and to get boosted. A little more than 50% of Hoosiers are fully vaccinated. The hospital census in the state is at a 5-year high, and Weaver says more than 80% of those inpatient with COVID-19 are unvaccinated. I asked Governor Holcomb and our top health leaders their plan on getting the nearly 50% of Hoosiers unvaccinated to change their minds.
I've been told that we're through converting people from very knowledgeable folks in the trenches that are caring for the very sick. And they've said, Eric, you're not going to get through to anyone else. You're not going to convert anyone. Having said that, others can. And I think that's critically important that we make sure, and we do, but we have to do everything we can to equip trusted, credible thought leaders within someone's sphere of influence. And that's how we'll continue. Otherwise, the only time I hear people change their mind is when through loss.
As someone else told me from northern Indiana, you know, that line in the sand has become a huge chasm, right? It's wider and deeper than it's ever been before. So I agree with the governor. It's going to be from people that individuals trust, and we do need to take time to listen to them and find out what are those things that may be a barrier to them getting vaccinated.
Now, it is noteworthy the state health department announced today it will no longer carry the Johnson & Johnson one-shot COVID-19 vaccine at any of the state-run vaccine sites. Weaver says it's due to lower efficacy and the risk of blood clots. Now, health officials say they remain positive and they look forward to the future and getting better, but they didn't mince any words. They say these next few weeks, they're going to be rough and they're going to be tough.
And Nikki, aside from vaccines, did the health leaders today talk at all about masking up?
Yeah, they did talk about masking up. So there's no mask mandate, I should say statewide mask mandate on the horizon, but health leaders, including Dr. Box, she suggests that if you're inside, vaccinated or unvaccinated, you should be wearing a mask. If you're outside, outdoors, and there's a large gathering of people, you should also be wearing a mask then. She also suggests to wear either a surgical or a KN95 mask over one of those cloth masks, just due to recent research that came out about that, Nicole.
Our Nikki Dementri reporting live tonight from the State House. Nikki, thank you.